I'm coughing so much. I wish this cough would go away.
Today in Manner Moments, we will be discussing the process of a respiratory assessment and different ways you can help resolve respiratory issues.
That's right. So the first thing you want to collect is some background information on your resident's health history. You want to pay attention to different things that will affect the respiratory system. So you want information on were they exposed to air pollutants, were they a smoker, or were they exposed to prolonged periods of secondhand smoke, and do respiratory diseases run in the family. Once you've done your health history, you're going to move on to inspecting. When you're inspecting your resident, you want to look for symmetrical movements. You want to also look for retractions, which you don't want to see. You want to watch for use of accessory muscles, signs of dyspnea or stenosis in the lips, and mucous membranes of the eyes.
Retractions are the sucking in of the skin between or around the bones of the chest when inhaling.
You also want to count the respirations of your resident for 1 minute and remember to take note of the pattern. Is it regular or irregular breathing? And also, are the breaths shallow or deep?
Be sure to also look for any signs of barrel chest. You don't want the chest to be rounded or bulging, and you don't want abnormal increase in the anteroposterior diameter.
Right, you want to palpate. You want to feel for any grating under the skin. This is called crepitus, and you don't want to find that.
When you auscultate, you want to listen for wheezes, crackles, pleural friction rub, or stridor.
Great, so we're going to finish off this week's episode of Manner Moments by quickly discussing deep breathing, coughing, techniques, and suctioning. For deep breathing, Haley, can I get you to demonstrate for me?
Yes.
Great, so you're going to instruct your resident to put both hands on their belly, fingers touching just above the belly button, and you'll have them take a deep breath in through their nose. As they do this, their fingers should pull away from each other as they breathe. Hold for 3 seconds, and then breathe out through their mouth like they're blowing out a candle. This is deep breathing.
Okay.
Next, Haley's going to go over the coughing techniques.
So there are 2 types of coughing techniques. One is called the huff cough, and the other is called a cascade cough. So I'm going to get Jen to demonstrate the 2 cough techniques. Okay, Jen, so the first technique, you want to breathe in deeply through your nose, and then you want to force a cough by saying huff.
Huff, huff, huff.
Yes. Good. So then the cascade cough, you want to breathe in deeply through your nose and then forcefully cough numerous times. All right.
So with suctioning, this requires a tube to be inserted in your either mouth or your nose cavity. And what it's going to do, it's going to suck out any secretions that remain down in the lungs that aren't released through deep breathing or coughing. It's kind of a last resort. It's not a very pleasant intervention to have to do, so we really try and emphasize the deep breathing and coughing. Thanks for joining us on this week's Manner Moments.
Bye.
Bye.
My doctor just told me I have to get surgery. Something to do with the bag getting put on my stomach. It's gonna carry my poop. I don't know what it's called, and I'm just really nervous. I don't want poop on the outside of my body all the time. Welcome to Manner Moments. Jen couldn't make it today, but I'm going to talk to you about ostomy bags. We're going to talk about colostomy and ileostomies. So an ostomy removes waste products from the body without using the rectum. A colostomy is an entrance into the large intestine through a stoma, and the stool that is removed by the stoma is quite formed and solid. Whereas an ileostomy is an entrance into the abdominal wall, and the end of the ileum is brought through the opening, normally on the lower right side of the abdomen.
You always want to look at the stoma. It should be pinkish red in color with no swelling. If you were changing, you would need to measure the size of the stoma to ensure you cut the new bag to the proper size, but we're just going to be emptying the bag. You want to take note of the effluent from the stoma and record the amount removed. You only want to empty the bag when it is about 1/3 to half full. In order to empty it, you will unroll the opening and ensure you have your container handy and your gloves on, and it is wise to have a blue pad handy in case of spillage. Since this is a colostomy bag, the waste will be more formed compared to the waste from an ileostomy, as it will be more liquid and easier to clean because the particles won't be stuck inside the bag.
Oh gosh, that peeing sure hurts. It stings like crazy. I'm gonna have to tell one of the nurses something's not right down there.
Welcome to Manner Moments. Today we will be discussing ways to decrease the risk of UTIs and the different characteristics of urine.
Right, a UTI is a urinary tract infection. The biggest thing to remember in preventing UTIs is proper hand hygiene and pericare. It is more common in women than it is in men because women have a shorter urethra and it's in closer proximity to the anus than it is with men.
And some interventions you can use to decrease a UTI from happening is to wipe from front to back, increase fluid intake of non-caffeinated beverages to at least 1.5 liters a day. You can also ensure that the foreskin is pulled down and thoroughly cleaned and dried, and be sure not to leave the foreskin retracted upon finishing your cares. You can also cleanse and dry thoroughly immediately after any incontinent episodes.
Right, and you also want to be sure to instruct your resident to report any burning or painful urination right away, as this is one of the first signs of a UTI. And in elderly people, abnormal confusion can be a first sign of a UTI as well. Up next on Manner Moments, we'll discuss the characteristics of urine.
Bye!
Bye!
This program is brought to you by Holland College.
Hi, welcome back to Manner Moments. Right now I'm going to discuss characteristics of urine, where we left off from the last Manner Moments. So as you can see from this chart here, you can actually tell quite a lot about urine. This is what we want to see. You want your color to be a pale yellow or straw colored. This is normal. If you don't have enough fluid in your diet and you're dehydrated, your urine's going to be a lot more dark than we really like to see it. There's quite a few different abnormalities that you can see with urine. If you have redness in your urine, either like a dark red or a bright red, it can indicate bleeding coming from inside, such as from the kidneys or the bladder. The medication is also a big factor on different characteristics of your urine color. For example, if you're on diuretics, it's going to be a pale yellow. And red, if it's not blood, it could be from anticoagulants. Orange and red, orange is from medication pyridium. And Elavil, if you're on that, that's going to cause you to have green or bluish green urine. And levodopa, for Parkinson's, that can lead to a brownish or black type of urine. Also, you don't want your urine to be cloudy. That can indicate some type of an infection. And you don't want there to be a strong odor. It shouldn't be, knocking you off your seat after you have a pee. And the pH of your urine, it's slightly acidic. The specific gravity of urine, that measures the concentration of particles in your urine. This isn't something that you know on a daily basis, but when you have a urine test done, you'll get those results back, and you want it to be between 1.010 and 1.025. And also, one of the other things with urine tests is if you have glucose in your urine, it's called glycosuria. Albumin is albuminuria. That's kind of a mouthful. If you have blood in your urine, it's called hematuria. White blood cells is pyuria. And if there's ketones, that's secondary to diabetes or starvation. So this is just kind of something to keep in mind if you're noticing some differences in your urine. One other thing too we didn't mention, food can also affect it. For example, if you eat a lot of beets, your urine might end up a little bit purple. So it's not always something to panic about, but if you or your residents are a bit concerned, this might be a good chart. Thanks for joining us on Manner Moments.
I'm trying.
3 weeks.
I know.
3 weeks.
3 weeks.
We're done.
2,
1. Let's go. I thought we were counting down.
No.